And happy WesTex Wednesday. Dr. Beck is live in studio. Thank you so much for being here.
Thank you.
And we're talking about diabetes. So can we break down 1 and 2? Because we hear them, but what's the difference?
Well, diabetes, of course, is where your body cannot regulate its blood sugars. And it's due to lack of insulin production by the pancreas. The pancreas is the organ that makes insulin, and insulin is what helps lower or control, regulate our blood sugar. That's mainly in type 1. Type 1 diabetes is also called juvenile onset diabetes because typically it's diagnosed in childhood or in adolescence. And unfortunately, sometimes when it's diagnosed, or frequently when it's diagnosed, they can be very sick, severely dehydrated, and have significant electrolyte abnormalities because they'll have vomiting and they're urinating so much they're trying to get rid of the sugar through their urine, so they're severely dehydrated, thirsty all the time, and have weight loss. Type 2 diabetes, on the other hand, is typically diagnosed. We used to think of it as being diagnosed in the 30s, 40s, and 50s, but we see people in their 20s now. They're diagnosed with type 2 diabetes. And although there is a lack of appropriate production of insulin by the pancreas, also there's a change in the receptor sensitivity to insulin. So we have insulin receptors in our body, and type 2 diabetes is managed differently. Type 1 diabetes should be managed with insulin, and that's pretty much the only treatment for type 1 diabetes. And there's various ways there's different types of insulin. There's insulin pumps, there's insulin injections, different types of insulin injections, short-acting, long-acting, that type of thing. Whereas with type 2 diabetes, the insulin is sometimes we have to go to that to help control blood sugars, but most diabetics that are type 2 can be managed with oral medication or non-insulin type injections.
And so type 2 is hereditary.
Yes.
What are some symptoms, even for 1 and 2, that might say, hey, I think I have a problem?
Right. Increase in urinary frequency, in other words, going to the bathroom more, being thirsty, weight loss, trouble fighting infections or clearing up infections, because diabetes does affect the immune system. It's hard for our body to clear infections when the blood sugar is very high. Those are some of and fatigue. Those are some of the most common symptoms that may present, and it may be diabetes is the underlying cause.
And is there anything super specific that I haven't asked you that has to do with maybe helping people at home, what they could start doing now to maybe preventative measures if it's possible?
Well, we know that type 2 diabetes, for instance, type 1 diabetes is one of those things that there's not much that can be done with type 1 diabetes as far as risk factors. When it happens, it just happens. Whereas type 2 diabetes, you can't control your genetics, but you can control your diet. You can control your weight. And those are some of the big risk factors for diabetes. And it's important to know also with diabetes, frequently we want to manage their blood pressure to the point that it's even lower than a non-diabetic. And most diabetics tend to have lipid problems where their cholesterol and their triglycerides and other fats in the system are high, or we have trouble regulating those, and those create other problems such as increased risk of heart disease and strokes.
Well, very good information. Where can we find out more from you, though?
We have 3 clinic locations. Our new location in Odessa is on 1941 East 37th Street, and our 2 locations in Midland are on the south side, and then on the north side. And our website is www.WesTexUrgentCare.com.
Dr. Beck, thank you so much for being here. Very important stuff. And stick with us. We'll have another look at our 10-day forecast. Stay tuned for more.